A story was told of a woman who went to the farm like every other day. But something remarkable happened to this woman on this fateful day. Meanwhile, she was 61 years old and had stopped seeing her menses 6 years ago. That was when she was 55 years. So as she was farming, she felt like urinating and left her farming tools, went to eat herself and noticed blood was coming out. She felt her menses had returned. This woman was so happy. She started calling on her co-wives, her close friends, everyone around, telling them to thank God on her behalf, for she has become a fertile woman again, that her menses had returned. She was so happy. When a woman has lived through her youthful years and reaches the end of her fertile days, one major thing happens in her life, and that thing is menopause. Menopause simply means end of menstruation. Menopause, like you're pausing the menstruation permanently. The cessation of menstrual period is recognized as menopause when a woman does not see her menses for 12 consecutive months, 1 complete year. Now the question is, if a woman who has reached menopause starts seeing blood again like menses, is it a blessing or a big problem? What do you think? Dr. Juliana Ome is the name, and the topic for today is cancer of the womb. The womb is a place where a baby stays and grows for 9 months. The womb is also that part of the woman's body where the menstruation flows out from. The medical term for the womb is endometrium or the uterus. So cancer of the womb is also called endometrial cancer or uterine cancer. Now, cancer of the womb is commonly seen at older age, mainly after menopause, but it is also seen in women who have not attained menopause. Cancer of the womb is more aggressive in Black women. Meanwhile, it is the commonest female genital cancer in the developed world. Like we have discussed in our previous health talks, cancer is a disease of the cells. And every part of the human body is formed by a group of cells. For example, the eyes have cells that form them. The liver has its own type of cell. The heart has its own unique cells. Even the skin is formed by a special kind of cells. Cancer is a disease where cells in the affected part of the body grow without control. They grow without following the right order. So cancer of the womb is when the cells of the womb grow out of control. And if you leave the cancer cells, they will grow and grow until they form a big tumor and even spread to other parts of the body. Now, in as much as we do not know the exact cause of cancer of the womb, there's a pattern noticed in women who have cancer of the womb. And these patterns are the things I want to communicate with us today so that we can learn and keep safe. One major factor that increases the chances of having cancer of the womb is a hormone in the body called estrogen. Estrogen is a chemical substance, a hormone in a woman's body that helps the woman to be fertile. It helps the woman to start seeing her menstruation at puberty. It helps for the development and maturation of the female breasts. It helps to maintain the heart of the woman. It increases good cholesterol in a woman's body and so many good functions. But the problem is that this same estrogen with all these good works can also be dangerous when the body of the woman is exposed to it for so long. It's like saying, hey, get some sunlight. It is good for your skin. But excessive exposure to sunlight can cause you sunburns and some other conditions, you get? Now, every woman is exposed to estrogen from the time of maturity at puberty until menopause, except during pregnancy and some parts of breastfeeding. A woman should stop seeing her menstruation around early 50s. On the average, at 52 years, the menstruation should have stopped. While some women stop at earlier age, some other women stop at later age from 55 years and above. The exact cause of cancer of the womb is not known. But over the years, some things have been noticed to increase the likelihood of developing cancer of the womb. And these are called risk factors, factors that will increase someone's risk. Any condition that makes a woman's body to have constant exposure to estrogen without break can expose that body, that woman, to cancer of the womb. For example, when a woman does not become pregnant in her lifetime, this is called nulliparity. During pregnancy, the dominant hormone in a woman's body is progesterone. So women who never got pregnant do not have break in estrogen supply and prolonged exposure to progesterone like we see in pregnancy. Another factor is when a woman starts menstruating at an early age or she experiences late menopause, this increases the number of years she has to see her menstruation and also the number of years she's exposed to estrogen hormone. Another factor is obesity. What happens in the case of obesity is that the body of the woman produces some amount of male hormones. And when there's excessive fat in the body, the excess fat will further convert the male hormones to estrogen, and this increases the estrogen level in the body. So the more fat a woman has, the higher her estrogen level. Then conditions like polycystic ovary syndrome, PCOS. In polycystic ovary syndrome, the body does not produce eggs every month. For the benefit of understanding, the menstrual cycle of a woman can be divided into two halves. The first half ends on the ovulation day, that is from day 1 to 14, while the second half starts from day 15 to 28, that is for an average cycle length. When a woman undergoes her monthly cycle, during the first half of the monthly cycle, the body produces mainly estrogen, while in the second half, she produces mainly progesterone. And progesterone is good for the womb. It stabilizes the womb. And when ovulation does not take place, the egg is not released. So that second half where progesterone is produced does not take place. So in polycystic ovary syndrome, there's little or no ovulation. This means the body does not get to release an egg as often as it releases in normal people. So the body does not have enough exposure to progesterone. That is why PCOS is a risk factor developing cancer of the womb. Another factor is age. The older a woman gets, the likelihood that she'll get to menopause and she's exposed already to having cancer of the womb. Then women who suffer from hypertension and diabetes. Also, cancer of the womb can be in family line. Families with hereditary colon cancer can also have other cancers like cancer of the ovary and cancer of the womb. This is called Lynch syndrome. And also family history of endometrial cancer alone is a risk factor. Now, in order to cope with the discomfort of menopause, many women take estrogen-containing therapy. So they expose themselves further to estrogen after menopause. So the use of hormone replacement therapy after menopause is a risk factor. Another factor is the use of a drug called tamoxifen. Tamoxifen is a drug used for treatment of cancer. In the breast, it protects the cells of the breast from the effect of estrogen. So it's good for breast cancer. While in the womb, it allows the effect of estrogen. And this definitely will increase chances of developing cancer of the womb. Cancer of the womb has symptoms. And the classical complaint in cancer of the womb is abnormal vaginal bleeding after a woman has attained menopause. If it's in women who have not attained menopause, they will present with bleeding in between their menstrual flow and then abnormally heavy menstrual bleeding. Now, how do we know that a woman has cancer of the womb? The major way to confirm cancer of the womb is by taking some of the tissues from the womb and testing them. This is called endometrial biopsy. Also by looking into the womb. This is called hysteroscopy. Even the use of transvaginal ultrasound scan is helpful in diagnosing cancer of the womb. Knowing that a woman has cancer of the womb is not a death sentence because cancer of the womb is treatable. Now, the key to successful treatment is early diagnosis. Once a woman experiences vaginal bleeding after she has attained menopause, it is a red alert. Please act immediately. You are advised to act immediately, not because it must be cancer, but because you will be easily taken care of in case the bleeding is due to cancer. Just like many cancers, the earlier cancer of the womb is detected, the higher the chances of survival. As much as possible, women with cancer of the womb should present early enough when the cancer is still in stage 1. That is when the cancer is still inside the womb only. And the best form of treatment for cancer of the womb is operation. The standard operation is to remove the womb, the 2 fallopian tubes or the oviducts, and the ovaries. And this operation is called total abdominal hysterectomy and bilateral salpingo-oophorectomy. You remove the womb, remove the fallopian tubes and the ovaries. Women who are not fit to undergo this operation, or women who have not reached menopause and they wish to preserve their wombs for childbirth, can be treated with hormonal therapy. Then other treatments include the use of chemotherapy and radiotherapy, especially if the cancer has spread by the time the patient presents to the hospital. As we all know, we must have some takeaway messages on how to protect ourselves. Number 1, it is good to maintain a healthy body weight, especially from your youthful age, so that it's easier to avoid obesity as you grow older. Avoid estrogen-containing treatments and hormone replacement therapy. Rather, use progestin-containing treatments, please. Go for genetic counseling if you have family history of cancer of the womb or colon cancer or other cancers. Then pregnancy. Do not run away from pregnancy, women. Pregnancy protects you. Just plan it properly. Okay? In conclusion, vaginal bleeding after a woman has reached menopause is not safe. It is not a sign that the woman has become fertile again. Instead, it is a reason to seek medical help immediately. And as we already know, knowledge is a starting point. The knowledge about the condition places one in a better position to seek for help. Ignorance does not automatically translate to protection. It does not confer any form of immunity. If you have watched this health talk to this point, I want to especially say thank you. And my wish for you is that you be in good health. And please, be the reason someone learns about cancer of the womb today. Share the link on your platforms. A lot of women do not know about this condition and they die without getting help. So please share this health talk, like the video, and also subscribe to our channel if you are yet to. Send in your comments and your questions. I will attend to them in record time. I love you all and I remain your favorite healthcare person on YouTube. Thank you very much and see you again.